And welcome to the Duke Spine Institute live stream. We have a patient who is having a C4-5 Duke laser disc repair, cervical. He's got a herniated disc at C4-5, shot. 2, 3, you agree? 4-5, Jordan? Sir. AP, shot. One more shot. AP. Perfect. Give me an AP. So we're placing a needle into the disc through the front. It's called the anterior cervical transdiscal. Perfect. We're right in the dead center where we want to be. And we're at C4-5. He's got a large disc herniation. You can see it on his MRI shot. And that herniation is literally crushing his spinal cord shot. There we go. You feel that? You feel it too, right? All right, so everyone agree we're at 3, 4, 5. 2, 3. Count for us, Jordan. 2, 3, 4, 5. 2, 3, 4, 5. We're supposed to be at 4, 5. All right, we're going to do a discogram shot. You're going to see a giant tear. There it is. Show us the herniation. You guys see the herniation in the back of the disc there, that dark dye? That is the herniation. And it's literally crushing his spinal cord. You can see on the MRI shot that he has his spinal cord being crushed. I need local. You see the white color in his spinal cord. That is edema. That's a spinal cord injury. This patient literally has a spinal cord injury. Okay, and we did a telemed. Where is he from? Port St. Lucie, so he's not too far away. We reviewed his MRI and showed him the problem. And he didn't want a fusion. He wanted something more advanced, less invasive. Y'all see the tear in that x-ray? Show the tear in the back of the disc. Henry and Sanjay, you see that little black line? That's the tear right there.
Yes, we do.
Shot. Taking out the needle and I'm replacing it with dilator. The dilator will literally run right over the guide wire. When you take the needle off, you got to be careful. Sometimes it'll catch on the guide wire and try to pull the guide wire out. Can't let it do that. Shot. All right. We're bringing our dilator down. You always got to watch the guide wire. It could go in too far, it could come out too far. You got to keep it right where it is. Shot. Now I'm going to bring this dilator down to the disc. The nice thing about this endoscopic surgery is it's pretty much bloodless. You're going to have a few drops of blood and that's about it. It's not like a fusion where you could lose hundreds of cc's of blood. And because there's so little trauma, you don't have bleeding, but you also don't have scar tissue. All right, that's looking good. We're right at the front of the disc. I want to get an AP x-ray and make sure I'm in the middle. Is that head straight? Can you straighten that head out? And let's get a nice AP. 2, 3, 4, 5. All right, looks good. He's a little bit curved off to the side, but you can see the tip of the dilator, Jordan, is right in the center. We're fine. Show us the tip of the dilator and show us the spinous process. Those are the spinous processes. He's lined up beautifully. All right, so we're right where we want to be in the midline, and we're up against what's called the anterior longitudinal ligament. Shot. I'm going to advance this dilator through the annulus to the back of the disc, right where the herniation is. Shot. I'm going to go a little bit further. Shot. Perfect. That's great. So I'm right where the herniation is coming out of the tear. At this point, I'm going to bring my tube down. Let's just do it for all of them. Yeah. Preserve the fenestrations. What are they called? There's a name for them. What are the little things that stick up in the castle around the turret called? Shot?
Well, it's called turrets.
Well, the turret is like the cylindrical structure, right? But what are the little, huh?
They're like gunnels.
Gunnels? Is that what it's called, a gunnel? We need a official recognition of what it is. Shot? It could be a gunnel. That's the little things that stick up?
That's where you put the cannons through.
Yeah,
It's a gun.
like a gun hole, but a gunnel. Excellent. Making our way back. Is that it? That's perfect. All right, very good. Very nice. Indeed. So Jordan, show us the tube. And where is the tip of the tube? It's at the back of the disc, right where the herniation is. You all see that?
Yes, we do.
Yeah. So we're going to go in and we're going to remove this herniation that's pushing on his spinal cord, causing damage to his spinal cord, which you could see on the MRI. Any questions from our audience?
No questions?
All right, let's show the audience why the herniated disc cause so much pain. It's from inflammation. Let's show us the audience how that works.
Copy that.
We are in the process of removing the herniation. And I'm going to try to get a little closer. We're at the back of the disc right here. You can actually see the herniation there. And it looks a little bit calcified. It's interesting. So our goal with this surgery is, number one, to get the pressure off the spinal cord because it's being crushed. Number two, to treat the patient's pain. He's having a lot of pain. This is all herniation here. Any questions from our audience?
No questions.
All right. Our first patient is making a nice recovery. See a little bone spur there.
We have a question from Vizzy on YouTube.
All right.
He says, "Hi, Dr. Duke.
Hi.
How would you address a symptomatic lateral foraminal disc bulge contacting L4, L5, exiting nerve root?"
I would treat that with the Duke laser disc repair. That's what I would recommend. The Duke laser disc repair could fix that perfectly because the Duke laser disc repair is a transforaminal approach. So we would enter the disc in the lateral area right where the herniation is. It's the best way to treat it. I feel like I'm a little overexposed, Jordan.
Good?
That's better.
Thank you, Elise.
Thank you. How did she do the last one? Good? Berndes? Huh? No asthma? Good. No asthma? Oh, great. Thank you. That's awesome. All right. You mean phenomenal anesthesiologist or phenomenal? What was the anesthetic?
Well, the anesthetic was sevoflurane induction,
Uh-huh.
lidocaine and propofol,
Uh-huh.
anesthesia, careful placement of the ventricular tube, deep extubation, keep an eye on the breathing, pull the tube out when they're
All right.
following the commands. That's the riskiest part.
Yeah.
Because if they're following commands and bucking, that triggers it. So no bucking.
That's awesome. What about what about using like lidocaine? Does that help or not really? Like spraying a little lidocaine. Oh yeah. See that herniation come out? That came out from behind the the huh?
We don't have LTA, laryngeal tracheal anesthetic lidocaine. We don't have that.
Should we?
That's this long to spray.
And should we?
Get it. It's good to have.
Yeah.
You get like have like 12 more around.
We have a question from HBK on
Hey,
YouTube.
whatever you need to make it better for the you and the patient. I get. Yes.
He says, "Hello, doctor.
Hello.
Is general anesthesia necessary?"
Yes. General anesthesia is necessary for this surgery. 100%. Without general anesthesia, the patient would be moving around and they would be very uncomfortable. We wouldn't be able to control them. With the anesthesia, we can control their blood pressure, heart rate, breathing, everything. Movement. This is a little harder than I was thinking it was going to take. There's a pretty good herniation here. And it's underneath the PLL. See that? Right there? Out in the foramen. And under the PLL. And it's very much stuck down to the dura.
We have a question coming from Elsia on YouTube.
Uh-huh.
She asks, "Will this procedure help with neck arthritis?"
Will this procedure help with what?
Neck arthritis.
Yes. It will. This is arthritis. We're fixing arthritis of the disc. That is what we're treating. There's other forms of arthritis of the neck as well. So you have to be treating the right form of arthritis. There's facet joint arthritis, and there's disc arthritis. We're treating disc arthritis. There's also facet joint arthritis. We can treat both forms at Duke Spine. But this particular surgery is for disc arthritis only. Well, it's a little longer than I thought, so I'd say another 5 minutes. These are swollen fibers of the PLL right there. And there's herniation just underneath them.
We have a follow-up question from Elsia on YouTube.
Yes, of course.
She asks, will it also help with facet arthritis?
This procedure that you're watching will not help with facet arthritis. Only disc. We do have a treatment for facet arthritis. It's called the Duke plasma rhizotomy. We did that on the earlier patient. It's a new treatment, only done at Duke Spine. And we use more powerful energy that's directed to the nerve for facet arthritis. The best thing you can do if you have somebody with that pain is to contact us and do our free MRI review. No charge. This is all scar tissue. Oh yeah. See the herniation? Everything okay, Luis?
Yes, sir.
Almost done. This is just a very, very challenging one because of the location and the size and the amount of scar tissue.
We have a question from HBK on
Sure.
YouTube.
Uh-huh.
Is the diameter of working channel same as lumbar spine?
No. No, the diameter of the working channel here in cervical is, the internal diameter is 2.8 millimeters. The external diameter is 4. For the lumbar spine, the internal diameter is 5.2, and the external diameter is 7. So this tube is half of the diameter, half of the size. A lot of herniation in the foramen there. You guys see all that? That's all blue stuff is herniated disc and scar tissue. And it's right on top of the nerve root. The nerve root is just underneath that. Have you ever talked to Santiago?
Not recently.
Let's flip it.
Last time was like a couple months ago.
So you do stay in touch with him.
Oh, yeah.
What's he up to?
He's, oh, you're not done yet?
No. Getting busy over there?
Oh, yeah. Well, I mean, last time that we talked, yeah. I mean, I can check with him.
I already called him.
Oh, okay. I mean, you talk to him?
I left a message.
Oh, okay. I can text him.
The fuck is this pedal? No, I'll talk to him. You're welcome to talk to him, but I need to talk to him. Does he have more than him as anesthesia?
Yeah, he works in a group.
I remember they were giving us an anesthesiologist. Remember? For a while,
Yeah.
they sent somebody.
Yeah.
All right, 2 minutes. This is the last of the herniation. It's a good size. Look at all the scar tissue. See all the blue color? Yeah. Yeah, you can spike it if you need to. It's not a problem. Gosh, look at that thing. That's a huge foraminal herniation.
We have a question from HBK on YouTube.
Yep.
At this moment, are you in the disc or outside?
When the discogram, I'm in the disc, inside the disc. We do the discogram inside the middle of the disc, or as close to the middle as we can get. All right, we're just about done. Really, actually went really well. Just a lot worse than I thought it would be based on the MRI. But that said, I feel really good about it. You know?
We have a comment from Busy on YouTube.
Uh-huh.
She says, many thanks for the previous response. I have sent my MRI
Trevor.
CD from Spain by post for your review.
Okay, very good. I look forward to meeting with you. Look at that herniation. You guys see that?
Yes, we do.
That's a big one. That's about 6 millimeters. I think that should be the last of them. Let's go check, make sure, and we should be done. Yeah, I look forward to doing your MRI review. All right. I don't really see any more. Just the PLL, posterior longitudinal ligament, looks pretty good.
Thank you.
That went nicely. Good job, Louise. Any questions, type them up. I'll answer them for you. This was a 1-level C4-5 for a large central herniation, but obviously there was foraminal herniation as well on both sides. Oh no, we're done. I think he'll do just fine. I'll show you guys this incision that we made. It's only 4 millimeters. So ACDF, the incision is typically around 30 millimeters. I'm sorry, 50 millimeters, 5.0. This was 4 millimeters. You guys see the difference? Amazing, huh? Are you seeing this, Sanjay? You need to talk to me. I
Yeah,
don't know
ye-
if you see it or not.
Yes, doctor.
4 millimeter.
Yes, we do.
Great job. I got this, if you can pass that off. Type your questions up. Our next surgery is what? Lumbar? All right. Go ahead and show our audience one of our testimonials.
Copy that.
I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
Dr. Duke Machen here at the Duke Spine Institute. I'm with one of my patients who's traveled to us from Mississippi. And he came here for the Duke laser disc repair to be done for a herniated disc on his neck. And he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well, no problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything is gone. A little soreness in my throat. My voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen. And there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery and I decided to give it a try. And I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused an adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
This is Dr. Duke Machen. I'm here with one of my patients who underwent the Duke laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. it just took a long time to recover from that. So this was much, much better.
Your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Duke and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations. It is February 23rd, 2022. And I'm here with one of my patients who has traveled from Kansas. Is that correct?
That's correct, Wichita, Kansas.
Wichita, Kansas, and clearly you've had surgery. We just did it less than 24 hours ago. You've got your incision there on your neck. How are you feeling today?
Much better. Much, much better. 26 years ago, I had a fusion of C6 and 7. They told me in Wichita that I would need to have fusions of C4 and 5 and C5 and 6. They set up the surgery for the 23rd March, and I'm going, I can't wait that long. This thing hurts, it's killing me, I cannot sleep, and so on. My husband Dale did a whole batch of research online, and he says, I want you to be able to move your neck after surgery.
Yes.
And
I did
he did a
Googling.
lot of research, and we found Dr. Duke to be a man of integrity. He films all of his surgeries. He puts many of them online, and you can see for yourself all the good work that he's doing, and that he really, really likes to help people. What he does is generally not covered by Medicare and not covered by some other insurances, but it very well should be, because it really helps people.
So what was life like for you before surgery?
My pain was mostly in the neck and shooting down my shoulder, and especially in my shoulder.
And you had really bad weakness with your arm. You couldn't even lift your arm, right?
That's
before
correct.
Surgery?
That's correct.
Show us what you can do now.
Before surgery, I could lift it to about here, and now I can lift it.
All the way
Yeah,
up.
just the next day, right
You couldn't
after.
do that before.
Yeah, that's because she had a herniated disc, 2 of them, C4-5, C5-6, and the herniations were literally sitting on the nerve. And we got in there, and if you watch this video segment right here, you can actually see there's the laser, and as we're removing the herniation, it literally pops right out of the foramen where it was sitting on top of the nerve, crushing the nerve. So, and the surgery was a success. We lost almost no blood at all, and you can see your incision is tiny, and here you are one day after surgery. It was outpatient, and you're ready to go home, right? You guys flying
Going
back
home tomorrow.
tomorrow? Okay, very good.
Try and enjoy a little bit of Florida today before we go back to the snow.
Okay, it is snowing there, huh, in Kansas?
Probably.
Okay.
If not today, then tomorrow.
Well, stay another week.
And yesterday it was 70
I
degrees
wish.
there.
70 degrees where, in Kansas?
Or maybe that was the day before it was 70 degrees, and
nice.
then they woke up to about 11 degrees.
Ah, so the cold front came in. We get those from time to time, and it gets cold around 60 degrees. Well, most of the time it's very pretty here in Florida. Well, we're glad you're here. Is there anything else you want to say to the world about herniated discs in the neck and surgery?
Dr. Duke will give you a free look-see on the MRI. It's well worth your time. And he will do a Zoom call with you and tell you what he can do for you. So go for it.
I said that it was so important that I said I'd pay for it. You know, because you know, we got a little bit of a nest egg, and sure it's going to cost a little bit, but it was worth it because we got results. I mean, that's amazing.
Your health is the most important thing in the world, people's health. So
You can't take it with you when you
yeah.
pass away.
All right, folks. We'll have a safe travels back.
Thank
Great
you.
to see you. Glad we can help you out. That's a nice.
Thank you.
That's a nice shake.
Good morning, I'm Dr. Dumajian. It's December 9th, 2022, and I have with me one of my patients who traveled from out of state, Texas to be exact.
Yes, sir.
And he's suffering with neck pain, and I'll let him tell you a little bit more about his symptoms, but he had herniated discs in his neck along with degenerated disc. We just repaired those yesterday, less than about 12 hours ago.
Yes,
as a matter
sir.
of fact.
Yes, doc. Yeah.
You're here now on post-op day 1. It was outpatient, no hospitalization. You stayed at the hotel. You're back this morning, and how do you feel?
I feel great, doc. You know, I just want to thank you right off the bat for you and your team for basically giving me another lease on life. I mean, the back of my neck, the tops of my shoulders. I had pain all the way down the back of my arm, and my elbow, and then also I had no grip. And today, it's all back. I just, you know, it's just a game changer. His procedures, because I've had fusions in the past, like 15 years ago, and those fusions, you don't want to do those because they just give you adjacent disc disease, and I have that problem right now on my back, and Dr. Dukes is going to fix it next week, so I'm very looking forward to doing that.
We'll be seeing him again next week after his back is fixed, but you broke it up into 2 procedures, and we get people all the time asking us, oh, can I come there and get my neck and my back fixed? Yes, you can. We'll probably do it on separate days. So you got 3 discs repaired yesterday. You can
Yes, sir.
actually see right here in this video footage how small the incision is, tiny. And I was in there endoscopically using a laser to clean out the tear and remove the small herniations. And now here we sent you home an hour after your surgery, and here you are back today. And how much of that pain did we get rid of?
All of it, doc.
100%.
I mean, 100%. And I mean, the doctor did. They did surgery on 3 different levels, and through a really small hole.
4 millimeters.
Yes,
4
doc.
millimeters. Incredible.
There's no stitches. It's just a Band-Aid.
Yeah.
You know, that's crazy. You know, if you have a fusion for three level fusion, I don't know how long that would be, but it's
it's
terrible.
about that long
Yeah.
for a 3-level fusion. And then of course you'll have swallowing trouble for months,
Not
and
good.
then you'll have pain, and you'll be on narcotics. Are you on any opioids or narcotics?
No, doc. Last night I went home and to the hotel, and I just took a Tylenol PM, and that's all the medication I've taken since the surgery.
Yeah. So with the Duke laser disc repair, you don't have to worry about getting addicted to painkillers because there are no painkillers. Literally a Tylenol, and that's it, because it's so minimally invasive. Far better than ACDF, far better than any other cervical type of surgery. Well, is there anything else you want to tell your fans out there before we wrap this up?
Yeah, I just want to let my parents know and my 10 younger brothers and sisters, if they're watching this, if you have back issues, you need to come see Dr. Duke, because he is one of the only people in the world that can do this procedure, and it is a game changer, and it's well worth it. At least give him a review. He'll do a free MRI review for you. I mean, it's just do your research, go to his dukespine.com, look at his website, and just do your research and give yourself a chance to do the right thing.
Well, thank you. And yes, now I'm the only one, but someday there will be another one
You hope.
who will be doing these
Yeah.
surgeries,
Yeah.
and probably better than me.
Okay, thanks, Doc. Appreciate
Thank
your
you,
help.
sir.
Yeah.
We'll see you soon.
Yeah.
And I'm Dr. Duke Machen, and we have just completed a Duke laser disc repair cervical for a herniated disc in the neck. And this patient, you could see on his MRI from before surgery, had a good size herniation at C4-C5. It was going backwards through a tear, pushing on his spinal cord, causing the white color in the spinal cord. That white signal, we call it, in the spinal cord on an MRI, is an indication of spinal cord damage. You should never see any change in coloration of the spinal cord. It's supposed to be gray on a T2 weighted image and even on a T1. So when you start seeing white on a T2 weighted image, that means there's edema and damage to the cord from whatever's touching it. That means the patient's at risk for being paralyzed. So the surgery was successful. We were able to get all the herniation out. The spinal cord did look swollen to me. It was kind of bulging a little bit, but you could see the swelling in the cord from his trauma from the herniation. That said, we got all the herniation out. It looked like some of it was old. It'd been there for a while, maybe up to 5 or 10 years. And there were some newer parts that seemed younger, maybe within the last year or two. But definitely there were multiple pieces of herniation over time that accumulated to make that big mass. But surgery went well. He's going to spend an hour in recovery, and then he's going to go back to his hotel or go home. Any questions?
Yes, we have 2 questions from HBK on YouTube. He asks, are you doing solely dorsal root rhizotomy yet?
Are we doing dorsal root rhizotomy yet? Yes, we do dorsal root rhizotomy. We call that the Duke plasma rhizotomy. And just so the rest of the viewers can understand what's happening, if you look at the cervical spine, you can see here that there are nerves, the black things, these lines, they come out of the foramen, they go back and innervate the facet joints. If you have arthritis in the facet joints, you get pain with movement. So we come in and do a rhizotomy here, and we cut these pain nerves. So that takes the pain away from the facet joints. But the most important thing is to determine if the patient has facet pain or disc pain. Because if you treat the facet joints, it won't fix the disc pain. They'll still have it. If you treat the disc pain, they'll still have facet pain. So you've got to figure out, do they have both? Do they have the disc? They have the facet? Which disc? 1 disc, 2 disc, 3 disc? Or, which facet? 1 facet, 2 facet, 3 facet, 4 facet? So that's the difficulty in diagnosing in spine is it disc, is it facet, is it both, and which disc, which facet, which multiple, and both sides, by the way. So it gets a little complicated, but Duke Spine Institute has mastered this. We're the best in the world at making the diagnosis to what's causing pain in the spine, and we are the best in the world at treating it with the least invasive treatments. That's why people travel the world to come here for their treatments. The next patient is going to be a lumbar Duke laser disc repair, and he travels from another state as well. I'll tell you which state it is when I go look at his chart later on.
We have a last question from
I know, I'm not done. Thanks, Sanjay. But the next patient, we're going to be doing lumbar. We're going to be approaching 2 discs, 1 left, 1 right, and then we're going to be doing the rhizotomy for the facets from L3 to S1 on both sides. So here's an example of a patient with 2 herniated discs with pinched nerve on the left at 1, pinched nerve on the right at the other. I'm going to do both. So I'm going to treat discogenic back pain, radiculopathy on both sides. I'm going to treat facet pain on both sides from L3 to S1.
Last question. During only rhizotomy, is anesthesia necessary?
During only rhizotomy, is anesthesia necessary? I love this question. No, it's not. If you don't mind pain, if you don't mind having pain, the anesthesia is not necessary. And I have had patients who did not want anesthesia. They said, I don't want anesthesia, just do it with me awake. And so it hurts. I'm going to tell you that. I'm not laughing at their pain, I'm laughing at the fact that people think that they could tolerate that kind of pain because they can't. It hurts like hell. And I would not want anyone to do it without anesthesia. But you don't need general anesthesia. We do sedation. So we give you a little bit of propofol at just the right time. That puts the patient to sleep. And then we do the burning, which takes a few seconds, which is really the painful part. It's like being electrocuted from inside your body. You know what? It's like being tased. So if you don't mind taser, then you probably won't mind the Duke plasma rhizotomy. It's like getting a taser. There's an electrical inside where we're operating.
And that's it.
Great questions. Thanks from the audience. We really enjoy your participation. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute and the Duke Joint Institute. And if you didn't catch it earlier today, we did our first hip Duke plasma rhizotomy. This patient had arthritis in the hip, couldn't walk, couldn't stand, couldn't do anything. Laying in bed was excruciating because her hip was hurting so bad from arthritis. We went in with 3 incisions, 2 in the front, and we went into the hip. Okay, I'll show you the secret. We went into the hip and we burned the pain nerve right here. Okay, can you see that?
Yes, we can. Yeah.
And then we went in and we burned the pain nerve right here to the hip joint. Then we flipped her over and we burned 2 more nerves in the back in these 2 locations. It took us 1 hour. The patient was asleep, and when she woke up, her hip pain that she'd had for 15 years, completely gone. And today it's still gone. No magic, no injections, no pills, just killing the pain nerve in exactly where it needs to be killed for the hip joint. She doesn't need a hip replacement anymore. She's going to walk out and she's going to have a normal feeling hip without having to have hip surgery and have the hip joint replaced. You are witnessing a revolution in healthcare and medicine. Literally, total joint replacements will be gone. And it'll be because of Duke Spine Institute and our discovery here at Duke Spine. Now also Duke Joint Institute, because we're going to be treating knees, hips, and shoulders. And people that are told they need a replacement, you don't need it, you come to us. Most patients can have the Duke plasma rhizotomy instead. Of course, if you have an infection in your knee, you can't have this procedure, you need to have surgery. But if you have arthritis of your knee or your hip or your shoulder, and it hurts to move it, we can take that pain away and give you back movement without pain for the rest of your life. That's permanent. Only at Duke Spine and Duke Joint Institute. Thank you.